Today, we have a new presumptive case of the COVID-19 virus, and this brings the total number of cases to 8, of which 2 are now confirmed. The new case is a male under the age of 10 residing in Zone 3, which is the central part of New Brunswick. The individual is a close contact of a confirmed travel case. So we have 2 travel-related cases currently, and what I'm saying is the new case is related to one of those travel cases. And this is expected in the sense that as we announce new travel cases, we would expect to see clusters of close contacts around the travel-related case. This new development underlines the importance of actions that we can all take to mitigate the impact of the virus on our province. Aujourd'hui, nous avons un nouveau cas présumé du virus responsable de la COVID-19. Cela porte le nombre total de cas à 8, dont 2 ont maintenant été confirmés. Le nouveau cas est un garçon de moins de 10 ans résident de la zone 3, région centrale de New Brunswick. L'enfant est un contact étroit d'un cas confirmé lié au voyage. Ce nouveau cas montre à quel point il est important pour chacun de nous de prendre des mesures afin d'atténuer les répercussions de ce virus sur notre province. I have spoken of the importance of social distancing, of putting space between yourselves and your fellow New Brunswickers, space that the coronavirus cannot cross. Regularly keeping a distance of at least 2 meters or 6 feet from people you come into contact with, along with other hygiene practices such as regular hand washing and appropriate coughing, sneezing etiquette will help slow the spread of this virus and keep people from getting sick. J'ai déjà discuté de l'importance de la distanciation sociale, soit de vous assurer de garder une distance sécuritaire de vos concitoyens du New Brunswick. Il faut laisser suffisamment d'espace pour empêcher le coronavirus de se propager. Il faut régulièrement demeurer à au moins 2 mètres ou 6 pieds des autres, ainsi qu'adopter d'autres pratiques d'hygiène courantes, comme se laver régulièrement les mains et le fait de tousser ou d'éternuer dans sa manche afin de ralentir la propagation et empêcher de rendre les gens malades. Yesterday, the provincial government acted on my recommendation to close a variety of public spaces, including cinemas, theaters, play parks, yoga studios, and buffet restaurants. The government has also taken steps to enable its employees to work from home wherever possible, and I have encouraged the private sector to follow suit. I'm encouraged by the proactive decisions many employers have taken on short notice to help us achieve our goals. All of these actions have been taken with the aim of enhancing social distancing and keeping people safe, to give our healthcare system the best possible opportunity to effectively deal with the crisis. I wish to thank New Brunswickers for their patience, their cooperation in implementing these important measures. These actions will cause inconvenience for many and hardship for many, but we must all bear in mind the responsibility we share in reducing the spread of this virus. By acting together, we can flatten the curve of the COVID-19 virus and decrease the incidence of illness and deaths for our fellow citizens. Hier, le gouvernement provincial a donné suite à recommander de fermer divers lieux publics, donc les salles de cinéma et de théâtre, les terrains de jeu, les studios de yoga et les restaurants de type buffet. Le gouvernement a également pris des mesures pour permettre à ses employés de travailler à partir de la maison dans la mesure du possible et j'ai encouragé le secteur privé à emboîter le pas. Je suis encouragée par les décisions proactives que de nombreux employeurs ont rapidement prises pour nous aider à atteindre nos objectifs. Toutes ces mesures ont été prises pour répandre le principe de distanciation sociale et assurer la sécurité de la population de façon à donner le plus de chances possible à notre système de soins de santé pour faire efficacement face à cette pandémie. Je tiens à remercier les Néo-Brunswickois de leur patience et leur collaboration relativement à la mise en œuvre de ces importantes mesures. Ces mesures causeront des inconvénients à beaucoup de gens, ainsi que des difficultés à beaucoup de gens. Cependant, il ne faut pas oublier que nous partageons tous la responsabilité de freiner la propagation de ce virus. En travaillant ensemble, nous pouvons aplanir la courbe épidémiologique de la COVID-19 et réduire l'incidence de la maladie et les décès connexes au sein de la population de la province. For many, a pressing concern is access to primary health care services. For routine health concerns such as follow-up appointments or prescription renewals, the normal process is to see your family doctor at their office. I know people are worried about potentially spreading or catching the virus through casual contact in a healthcare setting. On my recommendation, the Government of New Brunswick is taking actions so that you can see your physician for routine medical care without ever leaving your home. Effective immediately, physicians in New Brunswick will be authorized to see their patients virtually for routine services such as prescription renewals and providing follow-up health advice. You can receive care and advice over the phone or, if available to you, via secure video chat software. These provisions have also been authorized for psychiatrists for the provision of mental health care services. These measures will enable New Brunswickers to maintain social distance and still get the care they need. More importantly, the measures will better enable our healthcare professionals to focus on meeting the needs of the most urgent cases and minimize in-person contact in an environment where the risk of passing on infection may be high. De nombreuses personnes sont préoccupées par l'accès aux services de santé primaire. Pour des problèmes de santé courants, comme des rendez-vous de suivi et le renouvellement de médicaments sur ordonnance, il faut normalement se rendre au bureau de son médecin de famille. Je sais que les gens craignent de transmettre ou d'attraper le virus par un simple contact dans un établissement de soins de santé. Pour donner suite à ma recommandation, le gouvernement du Nouveau-Brunswick prend des mesures pour que vous puissiez consulter votre médecin afin d'obtenir des soins médicaux réguliers sans avoir à quitter votre domicile. Dès maintenant, les médecins du Nouveau-Brunswick sont autorisés à offrir des consultations virtuelles à leurs patients pour des services courants, comme le renouvellement de médicaments sur ordonnance et les conseils en matière de soins de suivi. Vous pouvez obtenir des soins et des conseils par téléphone ou par des logiciels informatiques comme Skype. Ces mesures autorisent également les psychiatres à fournir de la même façon des services de santé mentale. Ces mesures permettront aux citoyens du Nouveau-Brunswick d'avoir accès aux soins dont ils ont besoin, tout en maintenant une distance sociale sécuritaire. Plus important encore, ces mesures feront en sorte que nos professionnels de soins de santé pourront se concentrer davantage à répondre aux besoins des cas les plus urgents et à réduire au minimum les contacts personnels dans un environnement où le risque de propagation d'une infection pourrait être des plus élevés. We are all New Brunswickers, and we look after each other. Today, I want to make a special appeal to New Brunswickers who provide assistance to a group that will need our help, our family, friends, and neighbors who are returning to the province from their winter vacations. The announcement by the Government of Canada regarding travel restrictions has led to many Canadians deciding to return home from vacations or their winter lodgings in warmer climes. When these snowbirds return to New Brunswick, they will be directed to self-isolate for 14 days to assure they are free of infection. You can help your neighbors and friends by getting groceries and other supplies for them ahead of their arrival so they can immediately go into isolation and minimize their contact with other New Brunswickers. Many of you see this as a small kindness you might do as a matter of routine. It's just who we are. But these actions will help save lives, and those who do them are true heroes in this situation. Acts of kindness are acts of courage. When we help our neighbors and friends, we help ourselves and our greater community. Nous sommes tous des Néo-Brunswickois et nous prenons soin de un des autres. Aujourd'hui, je tiens à lancer un appel particulier aux Néo-Brunswickois qui viennent en aide à un groupe qui aura besoin de notre soutien. Les membres de notre famille, nos amis et nos voisins qui reviennent dans la province après leurs vacances d'hiver. L'annonce du gouvernement du Canada concernant les restrictions de voyage a incité de nombreux Canadiens à décider de rentrer chez eux après leurs vacances ou de revenir de leur logement d'hiver en provenance de climats plus chauds. Lorsque ces retraités migrataires reviendront au Nouveau-Brunswick, ils recevront la directive de s'auto-isoler pendant 14 jours pour s'assurer qu'ils ne présentent pas d'infection. Vous pouvez aider vos voisins et vos amis en faisant leur épicerie avant leur arrivée, afin qu'ils puissent s'isoler sur le champ et réduire au minimum leur contact avec les autres citoyens du Nouveau-Brunswick. Bon nombre d'entre vous considèrent ce genre de geste comme un simple acte de gentillesse habituel. Ce genre de comportement nous semblait inné. Cependant, ces gestes aideront à sauver des vies et ceux qui les posent, ce sont des vrais héros dans cette situation. Ces actes de gentillesse sont aussi des actes de courage. Lorsque nous aidons nos voisins et nos amis, nous nous aidons nous-mêmes et nous aidons l'ensemble de la communauté. Today, we have to help each other stay home and avoid spreading or contracting this virus. Together, we can do this. Thank you very much.
Good afternoon. Bonjour. As we just heard from Dr. Russell, as of today, there are 8 presumptive or confirmed cases of COVID-19 in the province. This was not unexpected, and it's why we are continuing to take measures to reduce the impact of this illness. It's important to recognize, as Dr. Russell pointed out, that this number of cases is directly related to the 2 travel cases. If we are all working together and doing our part, we can contribute to the flattening of the curve and preventing the spread of COVID-19. Right now, the best thing we all can do, whenever possible, is to stay at home. Si nous travaillons tous ensemble, nous pouvons contribuer à planir la courbe et à prévenir la propagation de la COVID-19. Présentement, la meilleure chose que nous pouvons tout faire, lorsque c'est impossible, c'est de rester de la maison. I want to remind New Brunswickers again of the importance of staying away from nursing homes and hospitals. People over the age of 70 are the highest risk of contracting COVID-19. We must all do our part to protect this vulnerable population by limiting contact with people living in long-term care facilities as much as possible. Starting today, the Department of Social Development is introducing an urgent nursing home placement process to address patients currently in hospital beds receiving alternate levels of care. Au compte d'aujourd'hui, le ministère du Développement social met en place un processus de placement urgent dans les foyers de soins pour les patients qui sont présentement à l'hôpital et qui requièrent un autre niveau de soins. We will be moving around 65 of these individuals into nursing homes around the province. People will temporarily be moved into nursing homes with 100 kilometers of their permanent address, within their permanent address that provides services in the language of their choice. In some cases, these individuals may not be placed in the preferred nursing home locations. By doing this, we will enhance the well-being of seniors who require 24-hour nursing care while freeing up dozens of hospital beds. This will allow for more capacity in our healthcare system to address the needs of people facing serious illness. It is very important to realize that patient transfers will continue to be necessary to ensure our hospitals will be able to manage this pandemic. It is important that we continue to look at these as opportunities to give better health care for seniors and to do it in a long-term and sustainable manner. Government is leading by example to demonstrate the importance of social distancing. Today, the Legislative Assembly is sitting with a quorum of 15 members. All of the parties are working together to pass a number of pieces of legislation, including the legislation to postpone the municipal elections planned for May. As well, this legislation will make it possible to postpone the provincial by-elections if that becomes necessary. Tous les partis ont collaboré pour adopter plusieurs projets de loi, incluant une loi pour reporter les élections municipales du mois de mai. Cette loi va aussi permettre de reporter les élections partielles provinciales, si cela devient nécessaire. A decision is also expected to be made today that the House is going to rise until further notice. This will help reduce interactions amongst members of the Legislative Assembly. However, the All-Party Cabinet Committee will continue to meet and play a crucial role in the management of this pandemic. As of today, only those public sector workers who work in critical functions or areas that support critical functions will remain on the job. All non-essential government employees are now working from home. As we announced yesterday, certain daycare facilities are staying open to support essential service workers. These facilities will follow the advice set out by the Chief Medical Officer, including reduced group sizes and social distancing. In addition, they will continue to follow strict health and safety directives. Essential workers can find information about accessing child care services through the Department of Education and Early Childhood Development's parent portal or by calling 1-833-221-9339. The province has also closed public access to correctional facilities, effective immediately. This includes all members of the public, including inmate family members, volunteers, and legal representatives. Inmates will be offered extra phone calls during this time, and the Department of Public Safety will continue to take advice from the Chief Medical Officer of Health. Some businesses have had to temporarily close to help us slow the spread of this virus. But I want to reassure New Brunswickers that we have confirmed that grocery stores and pharmacies have access to supplies and will stay open. We have spoken directly with the CEOs of our major grocery supply chains. And I want to stress, stores are not running out of food or essential supplies, and that empty shelves are being restocked quickly. They have also, in many cases, announced plans to not just keep pharmacies and supermarkets open, but to also set aside specific times for seniors and people with disabilities to shop. This is a great example of how companies can make life easier for our most vulnerable residents, and I know other businesses are taking similar actions. While some restaurants and coffee shops are closing their dining rooms or reducing the number of customers admitted at once, residents are still able to access food through drive-through and takeout options. I recognize that this is a very difficult time for business owners, and I want to thank them for going above and beyond to help limit the impact of COVID-19. I also want to call on banks to consider what they can do to help our small businesses and affected employees. This is not a time for foreclosures. It is a time for understanding and flexibility. Along these lines, we have asked NB Power to also be flexible in their billing and payment practices where extreme circumstances have been identified. If you are having difficulty paying your bill due to this situation, please contact NB Power. We are working directly with the federal government, and I cannot stress enough that they must act with urgency to assist small businesses and individuals who need help. I was very pleased to see Deputy Prime Minister Freeland and our Prime Minister announce the changes to international travels and the restriction into Canada. While our borders between U.S. and Canada remain open as a necessity for our supply chain, it is important to recognize that they did react. We had pushed this issue last week, and I was very pleased that they reacted earlier and this past weekend. At this point in time, we're also asking to reduce the uncertainty around who will get covered, what kind of options are available from the federal government in order to see that businesses can get back in business, in order to see that people are going home, not with a paycheck because they are in certain jobs, but who need a backup. So we have a situation right now where food supply, pharmacies, drugs are supplied. We do not have a concern. We need to equally make it assured that people will not have a concern to be able to financially continue their life for what they were used to because of this circumstance. So we will be continuing to work with the federal government. We are stressing to get an answer on this by this week and the next day or so. We will take action on this because we're not going to leave people at home that aren't being supplied with the necessities to live here in this province. I know this is an uncertain time for many workers. And I do encourage you, if you've been impacted, you have questions about employment insurance, which I understand the federal government has waived the time delays. The Government of Canada has set up a dedicated COVID-19 employment insurance line at 1-833-381-2725. We will get through this by following the recommendations made by the public health and helping one another where possible. Nous allons passer à travers cette crise en respectant les recommandations de la santé publique et en nous entraînant lorsque c'est possible. Already, we've seen so many examples of New Brunswickers going out of their way to help their family, friends, and neighbors. I've heard many stories of people reaching out to their senior neighbors and offering to bring them groceries, medication, and other essential items, and even offering to put gas in their vehicles. We are seeing examples of people offering these services to strangers through neighborhood social media groups. Then there are people like Moncton Magic head coach Joseph Salerno, who has personally offered to help families who rely on school breakfasts or lunch programs. We can always rely on New Brunswickers to be resilient during a crisis. We're seeing the best of people during these difficult times, and I know we'll continue to see more examples in the days and weeks ahead. Nous pouvons voir les bons côtés des gens durant cette période difficile. Et je sais que cela va continuer au cours des jours et des semaines à venir. We will get through this, and we will come out the other side by working together. We'll come out the other side stronger and more prepared to deal with any challenges that we face in the future. Thank you very much. Merci.
First question you can answer. Okay, folks, bonjour. Avant qu'on commence avec vos questions, before we begin with your questions, we'll ask that you state your question and place yourself on mute. I have Jennifer from Radio-Canada.
Geneviève, oui. En fait, ma question, c'est pour Madame Russel. Je ne sais pas si vous pouvez nous donner peut-être plus d'informations à propos du cas de l'enfant de moins de 10 ans qui a contracté la maladie. Est-ce qu'il a été, par exemple, en contact avec d'autres enfants? Est-ce que c'était avant que les écoles ferment?
Ça, c'est une bonne question au niveau de la... Mais pour les raisons de confidentialité, c'est l'équipe de la région qui ont fait toutes les contact tracing. Comment est-ce qu'on dit ça en français? Communication. Alors, toutes les communications entre le cas et la famille, etc., ça a été fait par l'équipe régionale. Puis, ça, c'est un processus qui ça a déjà été fait, puis les détails sont confidentiels.
Geneviève, as-tu suivi?
Oui, j'ai un suivi. Est-ce qu'on a vu plusieurs provinces récemment décréter l'état d'urgence sanitaire? Est-ce que vous pensez aussi faire ça au Nouveau-Brunswick? Et si oui, qu'est-ce que ça voudrait dire pour la province, pour les mesures d'urgence?
Est-ce que c'est... Peux-tu répéter la question encore?
Oui, est-ce que vous m'entendez bien?
Ah, OK. Oui, je peux répondre ça. Alors, les discussions sur les cas d'urgence dans une province, on est en train d'avoir des discussions sur ce sujet. On va faire des annonces fur et à mesure qu'on a de nouvelles informations. Alors, chaque jour à 2h30, c'est dans ce temps-là qu'on va faire nos annonces. Et avant qu'on prenne d'autres questions, je voulais faire une autre annonce aujourd'hui au lit du Prince-Édouard, parce que hier, ils ont fait une annonce au sujet d'un nouveau cas hier. Ce cas de hier que l'île du Prince-Édouard a annoncé, le médecin hygiéniste en chef a annoncé, ils ont aussi annoncé aujourd'hui des détails sur le trajet de le voyage parce que c'était un cas lié au voyage. Et cet cas avait voyagé le 7 mars sur un vol de WestJet 3440 de Toronto à Moncton. Et alors, ces détails-là viennent juste d'être annoncés à l'île du Prince-Édouard. Cette information, c'est sur le cas qui a été annoncé hier. Il est au voyage. Et je croyais que c'était vraiment important de l'annoncer aujourd'hui, puis je peux répéter en anglais. So I just wanted, before I take any more questions, just make the announcement around PEI announced a case yesterday, a travel-related case, their first case, and today they released a bit more information about that particular case, and the person had been symptomatic when they traveled on a flight on March the 7th, and it was a WestJet flight 3440, from Toronto to Moncton. I'll repeat that again. So it was WestJet flight 3440, from Toronto to Moncton on March the 7th. And so the case that they announced yesterday in PEI had traveled on that flight while they were symptomatic.
Michel Corriveau.
Oui, bonjour, Dr. Russel. Le son a manqué, alors j'ai peut-être manqué la première question, qu'est-ce qui vous a été posé, mais c'était ma question par rapport à ce vol de WestJet. Est-ce que les 70 personnes ont été contactées et si oui, est-ce qu'elles sont en quarantaine?
Alors, parce que c'est un cas de l'île du Prince-Édouard, principalement, c'est leur équipe qui fait les contacts, puis Alors, pour nous, aujourd'hui, on a les seuls détails qu'on a sur le sujet de ce vol. C'était la date du vol, puis c'était de Toronto à Moncton. Puis, pour les gens qui sont sur cette vol, les avis de nous, aujourd'hui, c'est de s'isoler. Et s'ils développent des symptômes, ils devraient téléphoner soit au 811 ou le département de santé publique au bureau régional. So, and I'll just repeat that in English. So those people that would have been on that flight, if they're New Brunswickers who are on that flight, we would like them to self-isolate and we would like them to call 811 if they have symptoms.
Michel, as-tu un suivi?
Oui, est-ce que, Dr. Russel, est-ce que cette liste, vous avez, la liste des noms est disponible quelque part, est-ce que vous allez les contacter, ces gens, pour s'assurer qu'ils sont en quarantaine?
Alors moi, à ce moment-ci, je n'ai pas de détails sur les noms puis les choses comme ça. Alors c'est pour ça que je fais une annonce publique. Alors comme vous savez, dans l'éclosion de la rougeole, si on n'avait pas des noms puis des informations pour les contacts, on avait fait des annonces au public. Vous vous souvenez qu'il y avait un cas qui avait visité le Harbour Station. Il y avait un autre cas qui avait pris un taxi. Alors, si on ne peut pas avoir l'information pour faire les contacts directs, c'est dans ce temps-là qu'on fait une annonce publique. Puis, l'île du Prince-Édouard va contacter l'équipe régionale, puis ils vont voir des discussions sur toute cette information. On va partager, on travaille ensemble, on va collaborer avec toutes les provinces. Alors, ça va arriver qu'il y a des personnes qui vont voyager d'une province à l'autre. Alors, c'est vraiment important que toutes les équipes provinciales, on travaille ensemble s'il y a des cas comme ça. Puis ça, c'est pas nouveau non plus. C'est le cas pour toutes sortes d'éclosions d'habitude.
Merci, Michel. Vicky Hogarth, Charlotte County.
Hi, if a person who lives in a rural community without access to transportation requires testing for COVID-19, how is that facilitated?
It's Blaine Higgs here. In relation to the transportation, if the case is identified through the 811 number, at that time through public health, if there are no other means of transportation, then that could be identified in that stage. I don't know that we've run into that at this point. I haven't heard of that being a situation, but that would necessarily apply. The next available opportunity obviously would be through our 911 and through the emergency service if that was an absolute need. So there's adequate ways to find someone a way to get to the hospital, but at this point, we would encourage someone that has symptoms and is mobile to look at alternate methods, but we will react in an emergency.
Vicky, do you have a follow-up?
How quickly are you able to get results once someone has been tested for COVID-19? Is it a matter of hours or days?
I believe it's 24 hours in the first case.
I think it ranges between 24 and 48 hours, and again, it depends on what time of day the initial sample is collected and processed, and it depends where in the province it comes from. They're all processed at the Georges Dumont Hospital in Moncton, and so again, it depends on where in the province the sample is coming from, and transportation time and processing time. So there's a range between 24 and 48 hours.
Thank you. Mike from Media Q. Mike? Matthew Wacomo, L'Acadie Nouvelle.
Mr. Premier, could you comment the decision to postpone the municipal elections and the by-elections? Why was it decided to do that, and when will we see those elections now that it's not happening anyway in the days that were first put forward?
So, Mathieu, I can comment of when the decision was made to put the legislation forward, and that was last week when the all-party committee met. And we had a presentation at that time from the chief electoral officer, and she indicated that her concerns about holding elections is scheduled in early May. And all the leaders, we spoke about this and decided that we'd bring, because legislation had to change in order to make this happen. And so that legislation is coming forward, or has come forward in the legislature today. I don't know at this point whether it has been voted on or not, but it was being presented as a recommendation from all the party leaders. So I would anticipate it will get passed, and it will reflect timing, whatever was agreed to there. The legislation would actually be looking at up to a year from the original date.
Matthew, as-tu un suivi?
Oui, and what about the by-elections, Mr. Premier?
It also included in that legislation, again, subject to the approval in the legislature today, it included extending the by-election, but I think it will likely put an end date on it, which would mean to be held, assuming the health crisis has passed, before the next sitting of the legislature, which at this point, if after the spring session, which could end soon, we would be in the fall session, and the by-election would be held prior to that fall session.
Thank you. Silas Brown, Global.
Hi, Dr. Russell. I'm curious, can you talk about what's being done to help facilitate and streamline the process for doctors and nurses who would like to come out of retirement to help out when we have staffing shortages and that sort of thing?
So at this moment in time, at the national level, there has been an outreach at the national level for people to come out of retirement to do some work on the response at the national level. At the provincial level, the RHAs as well as other government departments have their own, have reached out to some retired folks to recruit them into the response. So that work is happening. In terms of providing names to us, it's very easy to send somebody an email and offer that support. I'm trying to think what email or government, unless you want to email it to me, or I'm trying to think which email to send that to. But if people want to offer their support, we have been receiving offers of support. And we will continue to receive offers of support, again, through the RHAs. They have been doing their own outreach and looking at that. And then at the government level, we've been doing the same thing.
Silas, do you have a follow-up?
Yeah, I'm just curious, what would be the length of that process, expressing interest, and what would be the length of time expressing interest, and then potentially being able to be on the ground?
Well, I can only speak around the physician part, so it's not a very long process. Once we've identified a need in terms of, from our perspective, a resource perspective, and I assume it's the same in the RHAs, and if there's a need identified, and then it would be we've had conversations with the College of Physicians and Surgeons on this, so that's who we would be working with to facilitate this, and there's not a very long lag time between us identified a need and having somebody fill that and being able to get them on board. But again, that is the process. I can't really say a timeline on that.
Thank you, Silas. Laura Brown, CTV.
Dr. Russell, there's been some confusion about the two cases at UNB. Are those two cases already counted in the case that we have as of today?
So what I announced today was a case a case related to one of the travel-related cases, so a close contact of a travel-related case. I said it was a person in the central part of the province, and I said that person was under the age of 10. So that is what that is what I announced today. You're asking.
We all know that UNB has two cases, though, and I heard this morning from another outlet that those two cases are not counted in what was 7 this morning, now 8 today. Is it that we have 8 total in the province, I guess, including those two from UNB?
So, Laura, for confidentiality reasons, I'm only identifying and speaking about the cases that are presumptive and confirmed, and that number is 8. And so anything that's happening separate from that, that you're providing suggestions and information about, I can't confirm or deny for confidentiality reasons. All I can tell you is the information that I've provided already around presumptive cases and confirmed cases. The contact tracing that happens around that is the same process for each and every case. And what I can tell you is that as this evolves, I expect there to be more travel-related cases, and I expect there to be close contacts of those travel-related cases to occur. And as we wait for lab results for each and every one of these situations, we will update you. As I said, 2:30 every day, we'll provide more updates so that everybody is aware of all the same information that we're aware of in terms of presumptive cases and confirmed cases, and the reassurance around the contact tracing that's being done. That's the plan for every day.
Cédric, tu viens de l'Acadie Nouvelle.
Oui, j'aimerais savoir combien de tests préliminaires sont faits en ce moment.
J'ai pas entendu la question.
J'aimerais savoir combien de tests préliminaires sont effectués en ce moment. On sait qu'il y a 8 cas qui sont présumés ou confirmés, mais j'aimerais savoir combien de tests préliminaires sont menés en ce moment au Nouveau-Brunswick.
Alors, tu veux savoir combien de tests de résultats qu'on avait envoyés au laboratoire à Moncton ou au laboratoire à Winnipeg? Tu veux dire qu'on attend... Si vous allez sur notre site web, je crois que le nombre que vous cherchez, c'est 196. Ça, c'est le nombre de tests qu'on a effectués.
Cédric, as-tu une suivi? Elizabeth Fraser.
Hi there. My question is for the Premier. In Ontario, Premier Doug Ford has declared a state of emergency, which gives the province sweeping powers to order. And I know New Brunswick has a similar act, the Emergency Measures Act, which grants these powers to government. Are there any plans at all to invoke this if government feels people and businesses aren't complying with Russel's recommendations? And also, how many civil servants are now working from home?
So firstly, in relation to the Emergency Measures Act, I mean, yes, we could invoke that. However, we are counting on New Brunswickers across this province to use common sense here in avoiding any further or mitigating, let's say, exposure or continued contamination of others. The recommendations we put forward, if followed, will indeed put the necessary requirements in place that will actually limit exposure. If indeed people do not follow these regulations or recommendations at this point, we will have to look at other measures. But I'm confident that New Brunswickers will do their part. And I know it's difficult. I know it's difficult not to congregate and talk about this situation that we're in right now because it makes for great conversation. But I just encourage people to have that great conversation online. Have it by calling individuals or have it on a conference call. Just don't meet together to do it. It's just a right thing to do to protect yourself and to protect your friends. So at this stage, I'm relying on the integrity of citizens and business owners. Even though in the case of business, I know it's an economic hit, but we have to look beyond this because we want to minimize the economic hit so that it doesn't go on for months and months and months. We can see this peak and subside very quickly. And it's hard to define what quickly means, but we do know if people continue in their normal everyday practices, it will extend dramatically the timelines and the ability for our healthcare system to manage.
And how many civil servants would you say, or what percentage of them are now working from home?
I don't know the exact percentage, but I would guess we're certainly upwards in the likely the 70% range. But I can get some exact numbers for that and provide that tomorrow. What we do know is that we've basically focused on essential services only. We do know that we're drawing on those essential services from across other departments. So while the job that one individual may have had in their department wasn't deemed essential service and they were able to leave, I'm pleased to say many or some have said, look, I want to help. Put me wherever is needed. And as I said yesterday, I've had people say the same thing. You know, wherever we're needed, we're here to help. And that's encouraging. We want people to be safe. We will not put people in harm's way, but we do need people to step up and be available when we need them. And we're certainly seeing more and more signs of that. So we'll utilize our resources, and when I talk about resources, I'm talking about people carefully and cautiously and prudently. So we want their help when and if needed.
And do you have anything to say to teenagers who are pressuring their parents to let them hang out with groups of their friends, or anything to say to parents who are tempted to give into this kind of pressure?
Well, you know, I can speak to that directly because I have a daughter with 3 young children that is currently at home in Ontario, in Guelph. And we had this very frank discussion the other night on the telephone. And she was, many of the activities were canceled. And she was contemplating, you know, what can I do here? Should I be bringing, you know, I'm going to invite neighbors to come in and we'll talk. And I said, no. I said, don't be inviting neighbors to get in. At that point, I guess I acted more like the Premier than I did a father. But my point was clear that we need to find alternate ways to allow our kids to communicate with their friends. I know it's not going to be easy, but the thing is we're looking at this as short-term pain for long-term gain. And the only way we achieve that is, you know, it's a little rough in the household right now, but you really get to know your kids well when you're that close. In a daily routine of 24 hours. But I'm just encouraging people to weather the storm, you know, be close to their family during this time of need, because down the road they're going to all be thankful for it.
Thank you.
And will daycare operators in New Brunswick be provided financial assistance during the closures?
So we are working with the ones that, you know, we've said to many, okay, where we've closed many. We're looking at the ones for essential services. And what I want to say about that is that I don't want anyone going home and having to incur financial shortfall in the sense that it creates undue pain and hardship within their family and their conditions. I said earlier we have a supply chain that's working. We have food, we have health care. We want to have finances in order to ensure people are protected. So in the case of looking at home care, daycare workers, in the case of understanding how do we ensure that they have the financial means to continue their life, if they need to continue to pay for daycare, if they need to even though their kids aren't there, we need to make sure that everyone has the capability to manage life as they certainly are used to it and as they've known it, and that is our goal. Whether that looks like provincial support, whether that looks like federal support, we're pushing hard on the federal government who have already offered to assist in this way. We're tracking now people that are impacted. And what I want the New Brunswickers to be assured of is that we're not leaving any stone unturned, and we're not going to leave anyone left to their own devices to survive in our province. We have a great province with great people and great resources, and we're going to utilize them to their full extent to ensure that we meet all service needs.
Thank you very much. Andrew Waugh, Telegraph Journal.
Yeah, Dr. Russell, can you walk through the 8 cases and tell me which ones are presumptive and which ones are confirmed? So if you just do them one at a time, that'd be really helpful. I know you can't give any more information, but I just want to make sure we've all got our facts straight here.
So we have a total of 8, and my understanding is 2 confirmed and the 6 are presumptive.
Okay, and the 2 confirmed, one is in Southeastern and the other one is where?
My understanding is south.
Your understanding is the South?
Eastern.
Southeast.
Both in the Southeast. Okay. And, you know, I know you're saying that for confidentiality reasons you can't talk about whether these 2 possible cases in UNB are connected. But do you understand why that causes confusion when the university is putting out a press release warning everybody that there are 2 cases at UNB, but you can't confirm whether the number is actually 8 or 10?
Well, if you're speaking about the Horizon memo that went out to faculty, staff, and students at UNB, I'm aware of the information contained in that memo. And I guess my understanding, again, and this is going to continue for the entire duration of the outbreak, is my regional teams work at the regional level to do contact tracing and informing people of the information that they have that's pertinent, and that will be shared in the context of their response for each case. So I trust my team, and I really applaud their efforts and their work and all of the work that they're doing. So I sort of leave them to the regional work, and I really trust that that's the processes that are in place are working. And so what again, the information that I have is the same information that's on the memo, and as I read it, I don't see any numbers identified in terms of what you're asking about. So again, I can't confirm or deny the information that you're asking about. But at the end of the day, all of the measures that have been taken at the national level and at the provincial level to protect the health of New Brunswickers is the whole point of this, is that we want people to stay home. We want people to limit their contact with other people. We want them to wash their hands. We want them to self-isolate. And if you have symptoms, call 811. We're all working as a team here. The government, businesses, people, the public, families, friends, communities. We're in this together, and we need to really stand behind each other and try to really follow the advice that we're giving around the self-isolation, calling 811, because at the end of the day, I really understand everybody's concern about wanting information, but the most important information is what you need to do as an individual to support this whole entire response, and that is to stay home, especially if you have symptoms. Call 811. The only way to get through this together is to make sure that we protect our hospitals, to protect our physicians, to protect our nurses, to protect our frontline staff so that they can do the work they need to do as the number of cases increases. And we are preparing for that because we know the number of cases is going to continue to increase. And so with each and every case, we will do the contact tracing, we will do all the work that we need to do as part of the response. But again, individuals have their responsibility too, to stay at home, self-isolate, call 811 if you have symptoms. And this is the process that we're going to be completely, reiterating. And if you have, any correspondence from UNB, you can send it to me. Or one of my communications team, and we can have another discussion about that. But again, we're in this for the long haul. This is going to be a very long process, and again, we really need to work together.
Andrew, follow up.
Yeah, I understand what you're saying. I guess the press release that I was talking to actually came from UNB. That's what we were reacting to from the University of Warren.
Okay, well, if you want to send me that information, I'm very happy to review it. I personally don't have the copy of any UNB correspondence. I have the Horizon information in front of me. But again, I do understand why people are concerned about the information that they hear about, and it's really important to, again, we're in this for the long haul, and we're going to be working together, and all parts of government, public health, the public, businesses, and members of the community, and the media.
Thank you, Andrew. We're going to go to Danielle McCready, CBC.
Hi, my question's for Dr. Russel. I guess, what are healthcare professionals being told after returning from any international trips they've been on, particularly nurses and doctors? I know the messaging has been to, stay home, work from home, but these are, frontline people. So I guess how is the province working around nurses and doctors who are returning from international trips?
So my understanding is they're being given the same information with the exception of essential services, is my understanding.
So are they being told to go to work or to stay home?
I think Horizon would be able, like the regional health authorities have their own policies around that at this moment in time. In a general sense, we're telling everybody who's traveled for 14 days to stay home. That is our general message. But in terms of your employer, et cetera, and talking to the health authorities, what they would have, they would be making the decisions around that.
My next question for you, I'm wondering what requirements are in place for people who suspect they have COVID-19 to tell their employers to get tested? And I guess what can people do if they suspect a colleague has COVID-19?
Well, again, we're all in this together, so we are, the message is going to be repeated often, and it's necessary to hear it. You have to watch for symptoms, and if you have the symptoms, you need to call 811 and self-isolate.
So if someone you're sitting beside at work has a nasty cough and maybe a fever, but they're not listening to your asks to go home, I guess what kind of concerned coworker do? And is there a way for employers to enforce that person go home?
Well, that would be the employer's responsibility to deal with that issue.
All right.
Thank you, Danielle. Geneviève, as-tu une autre? Geneviève? Michel Corriveau. Vicky Hogarth.
Hello.
Oui.
Wait, I have a question for Premier Higgs. Premier, we know that the foreign workers won't be allowed in Canada. Ottawa confirmed that today. What's going to happen to our crab industry and our lobster industry?
Well, in terms of understanding just what impact this will have, I mean, many foreign workers are already here. So again, we're looking at ones that are traveling into the country. The requirements of the federal government and the details. We've had some, number of meetings. We're having regular meetings with Minister Morneau in terms of financial impacts and what that means. We'll be doing the same with the PM's office in relation to foreign workers and their ability to come in. Right now, I think the biggest issue is that we can keep the people we have. I dare say there will be a slowdown of new immigrants coming as a result of this, and it'll depend greatly in terms of the countries that they're coming from and the impact. But at this point in time, borders are closed. Only exception to that would be through Canada and the U.S. back and forth. So we'll have to deal with it look at one business impact at a time, but also the main issue is going to be protecting healthcare.
Will there be any kind of talks between the government officials and the industry to try to find a way through that?
Yes, indeed. Yes, indeed. We will understand precisely. We're asking for industry and businesses to make it very clear to us what their impacts are, and we will be having direct discussions with the federal government on those impacts, both for personnel and financial.
Thank you, Michel. Vicky, do you have another one? Vicky Hogarth? Mike from Media Q. Matthew Wacomo.
Docteur Russell, pouvez-vous nous dire comment ça fonctionne aujourd'hui dans les centres de dépistage qui ont été mis sur pied par les réseaux de la santé? Est-ce que tout se passe comme prévu de ce côté-là? Et puis peut-être que vous auriez même un nombre de tests là, qui a été effectué dans ces centres de dépistage depuis qu'ils sont ouverts.
J'ai pas reçu des nouvelles sur les centres de dépistage aujourd'hui, mais je peux revenir avec cette information demain. On va faire nos annonces de nouveau demain à 2h30.
Merci.
Merci.
Merci, Michel. Silas? Thank you. Laura Brown?
Dr. Russell, I'm just wondering, last week you announced the first presumptive case on Wednesday, and by Thursday you were able to confirm it by Winnipeg. I'm wondering if there's a delay now with the amount of cases, and if other provinces with more cases are jumping the line and getting their confirmation before we are.
I haven't heard of any problems with processing in Winnipeg, but I do know that my understanding is that we're going to be moving away from having to send all of our every single test to NML in terms of the negative ones. So I think that's actually going to help with if they're in terms of we won't have to be sending all of our negative cases for confirmation. So we'll only be sending the presumptive positives from now on.
Thank you, Laura. Cedric? Elizabeth Fraser, 1.
Hi there. My question is for Dr. Russell, just about the announcement today. She said that doctors could do virtual treatment of patients, but what about those people in the province who don't have doctors? Is Russell still encouraging them to try to go to after-hours clinics?
Yeah, that's a good question. The RHAs, again, they're really, I think they're really the ones in charge of the clinics at this point in time. And there was a French question around how things are going there and other details, and I didn't have the answer for that, but I said I'd be making an announcement again tomorrow at 2:30. So whatever information I can get on that, I will bring back to you tomorrow.
And when do you think we'll see the peak of this virus? And what are the projected numbers of cases and deaths?
So we have epidemiologists who are following the information globally and at the national level and provincial level. So I can't tell you exactly what's happening with those projections at this moment in time, other than that they're continually reviewing them and the information continually changes. And obviously with the measures that we're putting in place today, the whole point of that is to delay the peak and to, what everybody's saying, flatten the curve. And again, the whole point of that is to keep the pressure off the healthcare system, keep the pressure off emergency departments, and keep the pressure off doctors and nurses. And so if we are successful, we would hope to delay it. I couldn't say how long that would be at this point in time. Time will tell, but we'll definitely be continuing to look at that information, and we'll continue to update every day.
Thank you. Andrew Waugh.
With us now having a presumptive case involving a child, we've seen from a lot of media coverage that young folks don't really feel like they're particularly vulnerable to this. Does this kind of send a message of how serious this is regardless of your demographic?
We take every single case very seriously, no matter what the age. We do happen to know that seniors are affected more severely, and no matter what age you are, we are encouraging everyone to stay home.
Thank you. Dernière question, last question to Danielle McCready.
Hi, I'm wondering if the province will honor any contracts and payments to any supply teachers who are supposed to work over the next 2 weeks.
I think the education have put out a statement, or they will be, in terms of how that's going to be managed, but I'll just go back to my point rather than specifically answer that, is that we have said that people that are scheduled to work and that have lost, that aren't able to continue their income because we've made changes here in government and closed the schools in this case, that they will be compensated for that through continuation of their salary. So that we'd have to look at the schedules in that case. I mean, if someone was scheduled to work and it was clear, that is obviously would fit in the criteria. But I think education will be putting out some very clear guidelines in terms of how that payment structure will be laid out in the future.
Thank you very much, everyone. Thank you. Bon après-midi.